It is time for my weekly Ask Me Anything, and I have a couple of questions. I'm waiting to see if anyone's going to join me. But why wait? Why wait? I'm going to start with a question about chronic inflammation. Hi, welcome. Come and join me. You're welcome to put any questions in the comment section. I will try and answer you as soon as I can, but I've got a question to start with. It is about chronic inflammation. In particular, the question is, I've been diagnosed with I've got inflammation. What can I do about it? And I have a lot to say about this. I have a lot to say about inflammation, especially as it pertains to being fat. So, first of all, how do you know that you have chronic inflammation? The answer is you don't, unless it shows up on a blood test. Now, lots of people have chronic low-grade inflammation that is not going to show up on a blood test. The inflammatory markers that we look for in blood tests are the C-reactive protein, or CRP, and erythrocyte sedimentation rate, or ESR. Those are the two most common inflammatory markers that we look up. There are others, but those are the two we tend to look at the most. And most people who have chronic low-grade inflammation will have normal inflammatory markers. If your inflammatory markers are raised, that's a sign that something is going awry, and it could be anything, because inflammation in the body could be caused by all sorts of things, right? It could be caused by infection. It could be caused by an autoimmune condition. It could be hormonal. It could be that you've had like some kind of like trauma. And when I say trauma, I mean trauma to your body. So you've been in an accident, or just had an operation, or it could be like you have a blood clot, or it could be a sign of an underlying cancer. It could be all sorts of things. Chronic inflammation, raised inflammatory markers can exist for so many different reasons. And so when we see that they're high, we're like, something's happening here. And we have two choices. Number one is to say, all right, they're a little bit high, but they're not too high. Let's just repeat them and see what happens. And the other option is to say, let's figure out what's going on. And that very much depends case to case. And it also depends whether you have any other symptoms. What I am getting sick and tired of hearing is fat people telling me their doctors have said, you've got some, raised inflammatory markers. That's because of your weight. No, it isn't. It is not because of your weight. I don't know why doctors think it's okay to say that. And that's why we have to separate, when it comes to inflammation, these two things. One is raised inflammatory markers. Your blood tests have shown that you have some inflammation going on. There is something going on until proven otherwise. Okay, now it could be something mild. As I said, you could have an infection of your thumbnail or something. Like, it could be something relatively mild. Just having raised inflammatory markers on their own is not enough for me to say, oh, this is wrong or that's wrong. It's just a sign. It's like a check engine light, or an early warning sign of that something might be wrong. If that's the case, then your doctor needs to be actioning that. They do not get to blame it on your weight. That's ridiculous. Now, chronic low-grade inflammation is something that is happening inside of your body, and you're probably not aware of it, and you certainly wouldn't be able to detect it on a blood test. Not a standard blood test. I'm not going to get into too much detail, but there are ways that we can sort of see signs of it going on. But in general, you're not going to pick that up with the blood test. So let's separate the two, okay? So if your blood tests are abnormal, that requires action on the part of your doctor, whether it's just keeping an eye out and watching and monitoring, or whether it's doing some further investigations. Your doctor has a responsibility to look into what could be causing it. If it is low-grade inflammation that's not coming up on your blood test, you don't necessarily know it's happening, but that's something that I will refer to quite regularly. So like I was talking last week about insulin resistance, and I talked about low-grade inflammation. And I'll mention it quite a lot because we know that this low-grade inflammation is causing damage to our bodies, and is one of the reasons why people develop conditions like diabetes, or high blood pressure, or high cholesterol, heart disease. And it's also linked to serious conditions like cancer, and it's linked to autoimmune conditions. It's linked to all sorts of things. It's linked to arthritis. It's linked to, I could go on and on. So chronic low-grade inflammation is very important. It's caused by a number of things. And somebody asked me, okay, well, what do I do about it? How can I manage that? In particular, is there anything I can do, like in terms of diet or movement? And so what I think we have to be careful here is not to get sucked into wellness culture, but at the same time, not to say, oh, don't be ridiculous, none of that works or makes sense. I think if you look at sort of indigenous practices from, you know, generations and generations, we know that there are certain foods, there are certain roots, there are certain plants that people take to help with inflammation, and they've existed for hundreds and hundreds of years, and there's no way I would ever dismiss any of these as like, not, oh no, that's nonsense, that's hippy dippy bullshit, because just because there's no evidence, and just because Western medicine has not accepted these things doesn't mean that they don't work. At the same time, there's also wellness culture, and wellness culture loves to sell you all sorts of bullshit. You know, like what's the next thing? Is turmeric and black pepper, right? I am not saying for 1 second that turmeric is useless and doesn't help. People have been using turmeric for centuries, and so if you want to use turmeric to help with inflammation, go for it. You want to add black pepper into that? Also, go for it. I mean, you know, if you come from certain parts of the world, you're putting turmeric in literally every single dish, so that's all good. But at the same time, you need to stay away from wellness culture. There was someone who put a comment on my one of my videos, and I got a bit annoyed with this comment because I was talking about insulin resistance. And I was talking about how weight loss was not suitable for diabetes. And they were just like, oh yes, but I managed to get, you know, from diabetes, I managed to reverse my diabetes essentially just by adding in whatever they said that they added in. And I was like, I get it. I get what you're trying to say here, but actually this is not helpful. For the vast majority of people, adding in beans to your meal or turmeric and having turmeric tea isn't going to miraculously cure everything that is going on. So I'm trying to hold the complexity and the nuance here and say, look, I'm not saying, like, I genuinely believe that there are so many things out there that you can do to help with inflammation. Many indigenous practices that we should be listening to and paying attention to. And at the same time, be wary of wellness culture and you know, listen, like, you know, pay close attention to the person who's giving you the advice, is what I would say. Like, who are they? What do they stand for? And what are they trying to sell you? If they're not trying to sell you anything, you know, that's always a plus point for me. If they're trying to sell you something, red flag. So there may be things that you can introduce into your diet that may be of benefit when it comes to chronic low-grade inflammation. I am not an expert and therefore will not give any advice here. I don't know. I'm not saying yes, I'm not saying no. What I will always say though is that stress does cause inflammation. And we know this because stress, in other words, having stressors around you, things that are causing you to your nervous system to be activated, those things will cause chronic inflammation, because cortisol, which is released by the body in response to chronic stress, does what's the word I'm looking for here? Not initiates, but yeah, initiates certain inflammatory pathways that exist within the body. So cortisol is not good when it comes to inflammation. In fact, cortisol is bad for inflammation. So whatever you're doing, like say you're adding things into your diet, or like I'm going to try this, I'm going to try that, we need to make sure that it's not going to cause you any stress. I've just seen that comment. I promise you that I will answer it in a second. Go for it. Ask your question. Just pop it into the comments and I promise you I'll answer you. Where was I? I lost my train of thought. Make sure it's not causing stress is all I'll say. Introducing things into your diet that aren't going to like set you back financially, that aren't, you know, going to suddenly introduce food rules and make you anxious and worried, etc., etc. That's fine. Cutting things out of your diet. Stay away from that. It's bad for you. It causes inflammation. You don't do that. Please don't do that. That's not true. There's no evidence to suggest that. There's no like, if you eat that, especially if it's sugar, or if the advice has got anything to do with sugar or processed foods or ultra processed food or anything like that, that's wellness culture. Fuck that noise. No, I'm not into that. There's no evidence to support that. That is not causing chronic inflammation. You eat what you eat what you can afford to eat, you eat what you've always eaten, what makes you feel happy, you eat what you eat culturally, and don't listen to all this noise about, oh, that food will cause inflammation and that food will cause... No, there's no basis to that. There's no scientific basis to that. Same goes with movement. Movement's great if you want to do it, but you don't have to do it. How to manage chronic inflammation, chronic low-grade inflammation. For those who are joining, you need to watch the beginning of the video so that you know what I'm talking about. But it's tricky because there isn't like an on-off button you can press. There's no tablet I can prescribe. There's no magic wand I can wave. There's no exact science to this. But as I said, it's important to look at what causes chronic inflammation. So cortisol definitely causes chronic inflammation. Hormonal imbalances cause chronic inflammation. What else causes chronic inflammation? I mean, and there are certain things you can't do much about, like aging and things like that. So yeah, that's how I would address those things. I hope I've answered your question. This was the person who isn't here today, but yeah, hopefully that answered your question. So there's a question in the comments. I don't have holistic care from my surgeon, and there's no sense of holistic understanding and care as well. I have a very strong concern that my endosurgery will make things worse for me. Okay, so you have stage 4 DIE. I have to think what that stands for. DIE, tachycardia, axial. CPP. Okay, so you are somebody who has multiple complex conditions. And I'm also noticing in there fibromyalgia. So already there's a condition here that is dismissed often by doctors. Rheumatologists are like, oh, if you're deep in pathologic endo. Thank you. Stage 4 endo. Okay, horrendous. I'm understanding now. I get it. So you've got stage 4 endo, your tachy, you've got spondylitis and you've got fibromyalgia, and do you have Ehlers-Danlos syndrome? Just putting that out there. So you're not getting holistic care, and I totally understand this. And this is something I see in my clients all the time. In fact, that's a lot of times why clients come to see me, because if you've got a specialist, like say a cardiologist, who's doing things with your heart, and you've got like a gynecologist doing things with your endometriosis, and you've got maybe, if you're lucky, a rheumatologist doing something about your fibroid, probably not. And then you're like, and then you've got the chronic pain, you've got the chronic symptoms, the chronic pain, the chronic fatigue. And those chronic symptoms, the pain and the fatigue, are impacting your ability to do life, right? Because society is not set up to accommodate and care for people who have chronic pain and chronic fatigue. So then you've got, like capitalism and, all of that jazz. And at the same time, you're trying to manage these other conditions that are all linked, because often they are, right? I threw the Ehlers-Danlos syndrome out there just by the by, because a lot of my clients do have an underlying EDS diagnosis that isn't being taken seriously. Fibro doesn't get taken seriously. Rheumatologists will be like, rheumatoid arthritis, lupus, this, that, and the other. But the moment they're like, you don't have any of those things, your autoantibodies will come back normal, there's no evidence of inflammatory arthropathies, then they'll say, you've got fibromyalgia. Bye-bye! Because for many of them, it's not a real condition. Fibromyalgia absolutely is a real condition, and it is a debilitating condition, and I see it in a lot of my clients. So you have this chronic pain, and who's looking after it? I mean, you're looking after it. You're holding. You're living it. But what doctor, what healthcare professional is looking after it? Who's taking care of you? And then you have these like other people, like your gynecologist, who is involved in one specific part of your anatomy, which is the endometriosis, and doesn't really care about the rest of you. And also, even if they did care, wouldn't be able to manage the rest of you. The last time a gynecologist looked at something other than the female reproductive anatomy was back in med school, right? A long, long time ago. So they're no good. And to a lot of my clients, just like, well, who's looking after all of me? Who's looking after me? The only person looking after me is me. And I'm not a doctor. And it's really, really hard. Now, where I come from, it's the general practitioner's job to do that. And it's why I was passionate about general practice ever since I went to medical school. It's what I wanted to do. I like the complexity. I like jigsaw puzzles, and I like understanding things. Like the autistic part, the autistic part of me just needs to understand everything. I need to understand what's going on and how things are connecting with each other. And oh, if you pull this lever, like what happens over here? Like that's who I am and what I'm like as a person. So general practice has always appealed to me as a result of that. But nowadays, general practice, even in the UK, where general practice is, 70% of doctors in the UK are general practitioners. We have very few specialists in the UK because general practitioners take on the bulk of healthcare. The bulk of medicine is done by general practitioners. We do a lot more here in the UK than most GPs in other parts of the world, or primary care physicians or family practitioners, whatever you call them. But even here, like now, in the last few years, I'm not doing my job. Like I don't get to do any of that nonsense. Like it's you're lucky if you get an appointment with me. So there isn't someone looking after all of you, is what I'm trying to say. And it's really, really hard. It's why I left, general practice to do the work that I'm doing now. In order to do it, first of all, you need the time. My initial consultations with clients last 90 minutes, and I say to them before we start, look, I try and do it in less than 90 minutes and it never works. It has to be 90 minutes because that's the amount of time we need. So it takes 90 minutes just to get to know you. That's just the exchanging of information before anything else gets done. And so what I'm trying to say here is complicated. And I really, really hear you. And I understand why you're concerned that your endosurgery is going to make things worse for you. Because there's all these other things going on, and the people who are doing your endosurgery do not, like I said, they're gynecologists. They haven't had to deal with any of the other stuff. Fibromyalgia, they studied it in medical school, and that's it. They've never had to think about it again. That's really, really difficult. I wish that I could say to you, do you know what, I can fix things for you. And if you work with me, genuinely, if you work with me, this is what I do. It is basically my job. You're looking for someone who is going to give you holistic care, who is going to take all of those different conditions and say, I understand A, what all of these things are, and B, how they are impacting you, and then is going to say, now, what do you need? What do you, and how are we going to make sure that you get those things? That's what I do. It is my job. It is the thing I'm most passionate about. So if you fancy working with me, drop me a DM after this, message me. But I hear the frustration of not being able to get holistic care, and having to look after yourself. One thing that I try and instill in all of my clients, try to remind all of my clients, is you are the master of your own body. You know more about your body than anybody else does. And so that, rather than just being like, oh, I'll help you do this and I'll help you do that. It's, the whole like, give a man a fish, he'll eat for a day, teach a man a fish, he'll eat forever. I encourage, or I teach my clients how to figure out themselves what's going on, because you know already. You don't need a medical degree to know what's going on in your body. You know your body better than everyone else. And every time I've said to a client, what do you think is causing this symptom? They've given me a list of things, and their list has always been better than my list. If we compare lists, I'll look at their list and I'll be like, yeah, yours are better than mine. You thought of things I would never have thought of. Well done. So I teach my clients how to come up with like a list of things that could be causing their symptoms. We call this a differential diagnosis. I help my clients to then figure out what they want to do next. I'll say to them, all right, so what do you think we need to do? And they'll go, I think I need a blood test and I need an EKG and I need this, or, like they know. My clients always know. And as I said, again, they'll always say, what about an allergy test? And I'll be like, ooh, I didn't think of that one. Well done. I'll scribble it down on my allergy test. Brilliant. Okay, fair play. It is cheating. For me, I feel like there's a bit of cheating going on. But what's nice is that as my clients learn to do this, they get better at like realizing, oh, I do know. Like, I know what I'm doing. And so then what we do is we talk about, okay, so how are we going to get it? Because, you might know what you need, but you also need to be able to get it from a doctor. So I spend a lot of time with clients going, right, so this is now, what are you going to say to your doctor? How are you going to approach this with them? What are the words you're going to use? And so there is a way around this, folks. If you're sitting there listening to this replay, or you're here in the room right now and you're just like, I can relate to this person. I have fibro, I have chronic fatigue, I have Ehlers-Danlos, I have lipedema, I have idiopathic intracranial hypertension. If you have all these conditions that doctors literally are just like either ignoring, or they're just blaming on your weight, or they're telling you, you know, there's nothing we can do, yada yada yada, and you just think, that healthcare doesn't exist for me. I can't access healthcare. If you're sitting there feeling that right now, I'm here to tell you that you can. Healthcare does exist for you. It is possible to access the healthcare that you need. Absolutely, society sucks, but I promise you there are ways to get what you want to get without a fight, because that's really important, right? Without a fight. I hope that answered your question. Next question I have on my list is a question about chronic fatigue syndrome. So basically, the crux of the question is, what can I do if my doctor is not taking my chronic fatigue syndrome seriously? And this, I'm sure a lot of people are going to relate to this. This person, and it's not the first person that has been told this, it's not a real thing. Basically, it's not a real thing. It's a made-up condition. It's not real. I had another client who told me once that they were told that hypermobility. This person clearly had hypermobile EDS. They met all of the international diagnostic criteria. I don't know if they're international diagnostic criteria, but they met all the diagnostic criteria according to the Ehlers-Danlos Society. There's a diagnostic criteria, and they met them all. And so they were told by their, I can't remember which doctor it was, hypermobility is so common. It's like having overcrowded teeth. It's really common. And they told me this, and I was like, what the fuck is that meant to mean? Like, I don't get it. Like, when you have overcrowded teeth, overcrowded teeth actually, by the way, can be a symptom of Ehlers-Danlos syndrome, because often people with EDS have small mouths. But anyway, never mind. I have overcrowded teeth, and how has this impacted my life? It hasn't. Maybe I don't have the prettiest smile. I still love myself, even though it's crowded. I can still chew normally. It's not caused like cavities or caries or anything like that. I mean, it's just overcrowded. What's the big deal? EDS can cause so many different problems for people. So you've got your chronic fatigue, you've got your joint problems, your joint pains, you've got your joint injuries, which lead to arthritis later on in years. You've got your gut problems, you've got your POTS, you've got your MCAS, which is all about allergy. Oh, I could list them all. There's loads. How's that the same as having overcrowded teeth? And I was listening to this person who was asking the question about chronic fatigue, which was basically, I'm paraphrasing, so I didn't write it down, which was basically, I believe I have chronic fatigue syndrome, but I can't get a doctor to take me seriously, and can't get a formal diagnosis. This person was really struggling with it, and basically coming up, like hitting a brick wall every time they went to their GP. They live in the UK, and was asking for help, and it just made me really mad. Because their GP was just like saying it's not a real thing, or it's not, or like, you know, you're just tired, like buck up kind of thing. What? Like, ooh. Why do doctors do this? I don't get it. If someone comes to you and says like, I'm so tired, and I have been tired for a really, really long time, and these are my symptoms, why do doctors just turn around and go, it's not a real thing, or well, deal with it? I don't. Or are you really tired, or you know, or are you just a bit, you know, special? Maybe you just can't handle life. Maybe you're a bit depressed. Maybe you need an antidepressant. Maybe you're maybe you're hormonal. Maybe it's just because you're a woman. That kind of thing. That kind of bullshit. That attitude. And they don't say it out loud because they can't get away with saying it out loud. But you know that's what they mean. I just don't get it. It doesn't make sense to me. If somebody is so exhausted, if someone is so exhausted that they make the effort, go to the effort of making an appointment. Again, I don't know what it's like in other parts of the world, but in the UK in the moment, if you need to make an appointment to see a GP, it's like giving up your firstborn child. It's so hard. It's not like you just phone up and or go online and just book in. It's just not easy. It's really difficult to get an appointment with a doctor. In of itself is such a challenge that most people don't do it. So if they've done it, if they've made it through like, you know, the labyrinth in order to get into my office, or chances are they're on the phone, they're not even in my office, and they're talking to me about their fatigue, why on earth would I just be like, oh really, is that really a thing? Of course it's a thing. Why would they come to me if it wasn't a thing? I don't get it. Why would someone come to me describing a symptom that is having a very profound impact on their life if it's not a real thing, if it's make believe, if it's in their head? Like, why would they do that? I don't understand why doctors do it, but they do, right? And this is peak gaslighting, because that's what gaslighting really means. I know we use this term freely nowadays, but the term originates from a movie in which a man is trying to make his wife think that she's lost her mind by convincing her that what she's experiencing is not real. And that is exactly what doctors are doing. You go and see a doctor, you say, I'm tired all the time, and in the case of this person, I think I might have chronic fatigue syndrome, and your doctor's like, no, that's not a real thing. Oh, no, you don't. Oh, you know, have you tried eating less and doing exercise? Or, you know, maybe it's because you're not sleeping properly. Oh, it's because it's too much screen time. Oh, it's because you smoke. Oh, it's because you drink too much alcohol. Oh, it's because you're not doing enough yoga. Oh, you need to go for longer walks. They always come up with these stupid, just nonsense responses. And it's gaslighting. It really is. If you are experiencing, if you have like chronic tiredness and you know that there's something going on beyond, and that's the other thing that I was going to say. This person, when they asked a question about chronic fatigue, you know, was like, you know, I know I'm stressed. My GP's like, oh, it's stress. I know I'm stressed, but I've been stressed for a really long time. I've only been feeling this way since, and to be fair, I think it might be long COVID, but long COVID, chronic fatigue syndrome, I guess, you know, they have a lot of things in common with each other. And so I if you've been feeling all of a sudden, you suddenly develop these symptoms and you know that they're not just stress, and you go and see a doctor, that should be taken seriously. I know what I was going to say now. Oftentimes, there's more than one reason why you're experiencing a symptom. Again, this might be coming as a complete revelation to some of you, but there's oftentimes more than one reason why you have a symptom. I see that question about ME and long COVID. I'll come to it in a minute. When there's more than one reason, those reasons are all important. And just if you've got more than one reason, so like, let's just say, taking the example of chronic fatigue and stress. Oh, the doctor's like, well, you're stressed. That must be why you're feeling tired. No, it could be stressed and, right? It doesn't have to be either or. It could be and. Often it is and. And so we need to start listening to people. If a patient is like, I know, I've been stressed for a really long time. This is new. This is different. Something's going on. Then it is new. It is different, and something is going on. And we as doctors have a responsibility to address that. Now, to the person with the original question about chronic fatigue, I just so happen to be doing a masterclass on this. I'm doing a masterclass all about tiredness. It's called Why Am I Tired All the Time? And there is a free video, which I will link in my stories probably, and which answers a lot of questions. So that's the free part, and then there's the masterclass next Tuesday, 2 p.m. Tuesday, 3rd September at 2 p.m. You don't have to come live. You can just come. You can watch the replay. But if you've got any questions, you can ask me beforehand. So yeah, that might help to this person with chronic fatigue. Same in Ireland. Hard to get an appointment or a doctor to even take you seriously. An appointment is 15 minutes max. Need to put 2 appointments if you need over 15 minutes, and you pay for it, right? In the UK, at least it's free. You have to pay. Can you imagine? I hope you don't have to pay double just because you've got more than one problem. Like, it's not like body's just like, oh, I've only got one problem. Only one issue. No, it's not how it works. Someone has written, I've recently started blood pressure meds and I'm scared that this is the rest of my life problem. What would you recommend to change in order to get off them? Ah, what a question. I wonder if you can tell me why you're scared that this is the rest of your life problem. I hear you're scared. Very valid, very understandable, very, very common thought. Why does that scare you though? I don't know if you're still here and whether you want to answer. I can give you some best guesses, right? This is maybe not the forum to be going back and forth with questions, but Is it because you don't like the idea of taking pills? Totally understandable. Is it because there's some shame surrounding the fact that you are having to take pills? Because somehow having high blood pressure is a failing on your part, like, because of diet or lifestyle or, weight or whatever. Like, is there shame associated with taking pills? Is it that you're worried about the side effects? Is it a combination of all of these things? What I will say is that when it comes to high blood pressure, it is one of those things that we know that if we manage it and we treat it, that's exactly it. I felt like a failure. Okay, I'm glad you've answered. Thank you for answering that, for being so honest. Blood pressure is one of these things that I know I can say with confidence because I've looked at the data. If we manage it, if we keep your blood pressure within a certain range, it will have a significant impact in your long-term outlook. It will reduce your risk of a heart attack, a stroke, losing a limb, all sorts of things. Kidney health, eye health, all of those things. Treating your blood pressure absolutely will improve your health. And so if I just put it to you this way, look, friend, I know you have to take a pill. Nobody likes that. But it's going to reduce your risk of a heart attack, a stroke, like losing a limb, and it will significantly reduce your risk, long term. I'm sure you're just like, okay, cool, fine, I'll do it. I mean, most people would. I'm not saying you have to, and it's your business, it's your body, etc. But when you put it that way, there's like a real sense of, yeah, okay, that makes perfect sense. Like if I knew that there was a drug out there, my mum died of pancreatic cancer. If someone told me you take this drug every day, it reduces your risk of pancreatic cancer by about 25%, I'd be like, give me the drug, give it to me. I don't want pancreatic cancer, I'll take it. Most people don't see pancreatic cancer as a failing, but people do see high blood pressure as a failure, and it is not. High blood pressure actually is not linked to weight in any way. It's one of those conditions that actually impacts everyone universally. And it's, your weight has nothing to do with it. Losing weight, absolutely no benefit whatsoever. In fact, there are studies to show that fat people handle high blood pressure really well and are better able to maintain their blood pressure. So you really don't have to wait. It's nothing to do with weight. It's nothing to do with diet. I know we love to talk about it. People talk about alcohol and salt and sugar, yada, yada, yada. It's not. That's not why you have high blood pressure. It's genetic. And there's no question about it. It's genetic. There may be other contributors. I don't know if you were here right at the beginning, but we were talking about chronic inflammation. Chronic inflammation can cause raised blood pressure. So can insulin resistance. Again, all of these things are genetic. We tend to have early signs of them at a really young age, like teens, maybe early 20s. So it's nothing to do with you or your lifestyle. It happened long before you had a chance. It is what it is. There are certain groups of people who just have higher blood pressure, just on average. Black people, for example. It's a well-known phenomenon that people of African descent are more likely to have raised blood pressure. It just is. So it's just one of those things. I know, for example, my husband and his family, they were all on blood pressure medications at a really young age. They were in their 20s, 30s, and they felt like a failure. And I was just like, it's just genetic. There's nothing you can do about it. So many of my patients are on them. So what I want to say to you is, you are not a failure. There's nothing you could have done to prevent this. It happened. It's one of those things. You have high blood pressure. It's done. And whilst I would never tell you what you should or you shouldn't do, I will tell you that taking blood pressure medication is going to reduce your risk of having a heart attack or a stroke. And it probably means you're going to be on it for the rest of your life. And you may be able to come off them, maybe for a bit, but not long term. Probably not, if I'm being realistic. If there's an underlying cause, sometimes working on that underlying cause may help. But I think I need to do a high blood pressure masterclass, don't I? I think it's time. I haven't done one yet. I think I might need to. I enjoy talking about blood pressure. I hope that helped. There's another question here. Do you think ME and long COVID are the same thing? Ooh, I am not. You know what? I am not prepared to take on that question in any real way, because what the hell do I know? I'm not that clever. I think that, from what I understand of ME, and for those of you, ME, chronic fatigue syndrome, whatever name you wish to use, wish to apply, I respect you all. From what I understand, from what little we know, and remember, we don't know enough about this condition, there is probably a viral component. There's a strong indication that there's a viral component, right? That there are, that ME or chronic fatigue syndrome is often, maybe there's a genetic predisposition, maybe there are other factors in play, but it's often a viral infection as the catalyst. And I know that with ME, there was a lot of talk about infectious mononucleosis, I believe that was the one. I can't remember what virus, cytomegalovirus, Epstein-Barr virus. I believe both have been questioned. I think EBV is probably more, but this is like now I'm out of my comfort zone. You probably know more than me. So then we have COVID, and we're seeing people who are experiencing chronic fatigue after COVID. We know that COVID makes us tired because anyone who's had it knows that they feel exhausted after it. And if you're like me, you get a very mild illness and then you're exhausted for a little while and then you get back to normal. Excuse me. I think I might be recovering from my latest bout. I didn't test. I couldn't get to that. I couldn't get a test, and then anyway. So with COVID, some of us just felt exhausted for a couple of weeks, and some of us 3 months later were feeling exhausted, and now some of us, like 3 years later, are feeling exhausted. That's remarkably like the same pattern as ME, right? Like, I'm not saying it's the same thing. And I also understand that with long COVID, there are other things as well. There is an issue with blood clotting, and etc. etc. You were a first waiver. You were right at the beginning. You were the one. And there must be a reason why it's happening to some people and not others. And we don't know what that reason is, but there must be a reason. All I know is that long COVID is a real thing. And any doctor that says otherwise literally gets a slap in the face from me, a metaphorical one. I'm not physically violent, because COVID has only been around for 5 years. There is literally no way we can rule anything out at this stage. It's right at the beginning. We cannot, with any confidence, to say no is really hard anyway. You have to have, I'm not going to say balls, but the equivalent of, you have to have courage to say no. No, it's not a real thing. Whew, that's bold. You can say, I'm not sure if it's a real thing. Maybe it's a real thing, maybe it's not. Or if you're like me, it's probably a real thing. It's a phenomenon. Something's going on, but I don't understand enough about it. You can't say no, it's not a real thing. So I think that's very important, that doctors who are denying the existence of long COVID, really? How could you possibly know? Denying the existence of any condition is hard enough, but long COVID, it's not been around long enough. We do not understand anything. We're right at the very beginning, and we won't understand anything for another 15, 20 years, if we're honest, right? It just takes that long. So I'm really sorry that you are the first, that you've had it for 5 years, and you're not the only one. And I have colleagues, there are doctors who, and healthcare professionals, because we were some of the first. I got my first bout of COVID was March 2020. We didn't have tests, but I got it the day before we locked down. So we'd had a few patients by that point in time that clearly were positive, and didn't even have the tests at the time, except for if you were in hospital where we were starting to swab. And so I had a few patients over the last few days who had then ended up in hospital with it. So I caught it in March 2020, but I was really lucky. But I have colleagues that was it, they were out. And it's so hard because people don't believe you. There is an issue with getting, there's an issue with getting people to even acknowledge that it exists, that it's a thing, and then you're just having to fight. And then also you're fighting for what? For healthcare that, like I said, doesn't exist yet because we don't understand it enough. It must be so hard. I don't blame you for taking precautions. And it must be really hard because most of the world has moved on, which is always the case with disability. The world moves on, COVID's over, pandemic gone. Remember the time when we had a COVID pandemic and then there are other people sitting there going, are you kidding me? Because, it's definitely, it was over the month of August, there was a massive upsurge. Just people were getting it all over the place. So it's not like it's gone, but we're no longer are scared of it. And then there's this group of very vulnerable people who are like, what about me? I got left behind. So that must be very, very hard, Lisa. I'm sorry that you're going through that. You have my utmost respect, if nothing else, because it must be like to just keep going. I try to imagine, like, you know, to get up every day and just keep going, keep, you know, wearing that mask and listening to people talking crap. Like, it must be really hard. I can only try and empathise. Like, there's as much as I can give you, but yeah, I'm sorry. Right. Any more questions, anyone? I didn't have any more given to me. I'll talk a little bit more about this masterclass that's coming up. So why am I tired all the time? I was asking myself this question. Why am I tired all the time? And then I thought, other people are asking themselves the same question. A lot of people I'm meeting are like, I can't even get a blood test. Like, I can't even get, basic care. And so I was like, there's a problem. It's a problem for me. And of course, I always think of myself before I think of anyone else. So I was like, I'm going to do a masterclass on tiredness and fatigue. And so then I was sitting down to do it, and I was like, God, there's a lot of reasons why people are tired all the time. So I started writing about that. So I wrote and I recorded a video, and it's on YouTube, and I will link it here on Instagram as well. And if you go to learn.fatdoctor.co.uk and you go to the masterclass, this video is free. Like, it's like I think it's called free preview or something. You just click on that and you can watch the masterclass or watch it on YouTube or whatever. And basically I wanted to kind of give a little bit of a rundown of all the different reasons why people will feel tired all the time. And there's loads. Some of them are medical, some of them are complex, some of them are mental, emotional. I bring up neurodivergence because that's a common one. Anyway, it's really important to me that people have a basic understanding and knowledge of this. Also to understand that it has nothing to do with weight or lifestyle or diet or exercise, whatever that doctors tend to blame it on, which is nonsense. There's almost always at least a cause, but as I said, more often than not, several causes, several things going on at the same time. So there's that video available. And then on the 3rd of September at 2 p.m, we're going to be talking about how to actually manage this condition. Like, I'm feeling tired all the time. What do I do about it? And that's what we're going to take you through. We'll talk about how to get your doctor to take you seriously, how to get the test that you need, how to get the support that you need, the treatment that you need. And I'm here for questions, just like this, questions and answers, but in a much more intimate setting. So learn.fatdoctor.co.uk. It's all on there. And check my stories, etc., etc. Check my website, fatdoctor.co.uk. And I hope some of you will join me. If you're feeling tired and you want to know why and what to do about it, I hope you'll join me. I'll be back next week for my next Ask Me Anything. Please ask me questions, otherwise I don't know what to say. I just sit here. No one's asked me anything. So yeah, see you next Wednesday. Thanks all for listening. Take care.